Hello, I'm Dr. Alina Cortez, and this channel is all about real sexual health, simple, scientific, and stigma-free. Welcome. Have you ever felt a sharp, sudden pain deep in your pelvis during intimacy? Like hitting a wall inside? You are likely experiencing collision dyspareunia. In this video, we break down exactly why deep positions hurt, the anatomy behind the bump, and 3 instant fixes you can try tonight without medication, based on guidelines from the Mayo Clinic and the International Society for Sexual Medicine. What is collision pain? That sharp ache, nausea, or cramping feeling during deep penetration happens when the cervix is hit directly. Unlike the vaginal walls, the cervix has visceral nerves, meaning impact feels less like touch and more like a gut punch or deep cramp. You aren't imagining it, and it is very common. Reason 1. The tenting effect. Timing is everything. According to physiological research, Masters and Johnson, the vagina isn't a fixed tube. When fully aroused, a process called tenting occurs. The uterus lifts up and the vaginal canal lengthens, sometimes by 2 to 3 centimeters. If you rush past foreplay, the cervix stays low, making collision inevitable. The fix? Slow down. Arousal is physical mechanics, not just a mood. Reason 2. Anatomy and medical causes. Sometimes, even with full arousal, the pain persists. Why? Retroverted uterus. If your uterus tilts backward towards the spine, the cervix sits differently, often leading to easier collisions in standard positions. Ovulation. During the middle of your cycle, the cervix can drop lower. Conditions. Endometriosis, fibroids, or even constipation, IBS, can make the pelvic floor hypersensitive to deep pressure. Instant solutions. How to fix it tonight. 1. Buffer rings, e.g. O-nuts. These are soft, stackable rings worn at the base of the penetrating partner. They act as a bumper, physically limiting depth while keeping the sensation of full insertion. 2. Angling, the CAT method. Instead of thrusting in and out, use the coital alignment technique, grinding/gliding motion. It focuses on clitoral stimulation rather than depth. 3. Positional changes. Avoid positions where legs are wide open or pulled back, which shortens the canal. Try spooning, side-lying, for controlled shallower depth. When to see a doctor? Pain during sex is common, but it is not normal. If changing positions and extending foreplay doesn't stop the pain, please consult a gynecologist or pelvic floor physical therapist to rule out infections or endometriosis.